Hello and welcome to the next video in this series on health, disease and medicine. What we're going to be talking about today is we're going to be talking about cardiovascular disease as an example of a non-communicable disease. So we're going to talk about what cardiovascular disease is. We're going to talk about the effect of smoking and obesity on the risk of cardiovascular disease, which I've abbreviated to CD here. And then also talking about why is there a different range of treatments for cardiovascular disease. So cardiovascular disease, a disease of the heart. Now, what essentially cardiovascular disease is it's to do with the narrowing of blood vessels. But these are the vessels around the heart. Now, what these could lead to is if you've got narrowing of these vessels that provide the blood to your heart, it gives you an increased chance of things like heart attack and also strokes. So just very, very briefly, the difference between a heart attack and a stroke. A heart attack is where the vessels around your heart have got blocked and blood can no longer be transported to the heart, so your heart tissue starts to die, and that's what causes chest pains from a heart attack. A stroke is when a blood vessel from the heart to the brain is blocked and it causes damage to the brain. And so they have slightly different symptoms. Heart attack is chest pains, strokes tend to be more slurred speaking or half the body becoming sort of temporarily paralyzed. So they might sort of lose expression in one side of their face. So that's what cardiovascular disease is. It's a disease of the heart, but it's to do with these blood vessels being narrowed. And we'll talk about how that happens in a minute. Now, if we move on to the next bit, which is talking about how smoking and obesity increases the risk of cardiovascular disease. And one of the sort of well-known things about cardiovascular disease is it's heavily linked to those two things. Now, if you are obese, you are more likely to suffer from cardiovascular disease. The risk is increased. Now, the same goes for smoking. If you smoke, your risk of cardiovascular disease is increased. So how can we measure some of that risk? Okay, well, if we're talking about obesity, what does it mean to be obese? Now, the way in which doctors assign whether people are obese or not is using something called BMI. So, if we look at how to calculate BMI, it gives us an indication of whether somebody is obese or not. So, your BMI, which is your body mass index, that's what it stands for, body mass index, body mass index. Okay, what this equals your mass divided by your height squared. Now, a couple of important things about this, because you might be asked to calculate it. Okay, the mass is measured in kilograms, and the height is measured in meters. So that's something that you might be asked to calculate. Now, as far as doctors are concerned, if you have a BMI that is greater than 30, okay, you are classed as obese. Okay, so that is what obesity is. Now, another thing that people use to identify as to whether somebody is at risk because of their obese is their hip to waist ratio. Now, this just simply involves measuring the hip and measuring the waist and seeing what the ratio is. Recent research has also shown that actually this hip to waist ratio is a better indicator than BMI. So again, the greater that ratio of difference between your hip and waist, the greater your risk. So in general, okay, what does this mean? If you're obese, it's going to increase risk. It doesn't necessarily mean you're going to get it. It just means that you're more likely to because you're exposing yourself to more risk factors. Okay, well, what about smoking? So if we're thinking about smoking, smoking contains all sorts of different chemicals. So within smoke, there are all these chemicals. Now, what these chemicals can do is these chemicals can get into the blood. Now, if they get into the blood, what they can do is they can damage the walls of the vessels. Now, if they get into the blood and they damage those walls, what can happen is you get a little fat buildup. So let's say we've got some vessels. Here they are. This is going to be like a little timeline. Okay, so those are our blood vessels. Now what happens, okay, is we have blood going through here, our blood vessels. So these are my blood cells, okay, and those are traveling through the blood, nice and happy. Now what happens is at some point one of these chemicals damages the wall, okay. So here is where we end up with some damage. Now what happens is that blood will continue to flow. Now within blood, we've also got some different things. We've got things like fats, sugars, all sorts of different things in our blood. Our blood is our main transport system. Now what will happen is where that little bit of damage is caused, fat that is in the blood will start to build up, okay, around that point. Okay, so here we go, here's our orange fat. Okay, what it will start to do is it will start to build up around that damaged part. Now what that does is it suddenly narrows that artery, that vessel that transports all that important blood. Now it can get to the point where this blockage gets really quite severe, really narrowing that artery. Now if we have a really narrow spot, what happens is our blood cells will actually block up the final part here. And what will happen is you'll end up with a blood clot forming. So this actually blocks the vessel. Okay. Now, if this vessel, this artery, is a vessel providing oxygenated blood to the heart suddenly won't be able to operate properly. The heart is one giant muscle. Muscles need oxygen in order to work. You need oxygen in order to respire, so they've got energy to do the job that they do. So what will actually happen is part of that heart will die. Okay, the muscle around there will die, and that is what causes the agonizing, the angina and the pain. Okay, and what can actually that can lead to is it can lead to cardiac arrest. Okay, which is where the heart can no longer beat in its proper rhythm, and that's potentially fatal if not treated very, very, very quickly. So clearly here again, smoking, it increases your risk. Again, I want to highlight here that I'm saying it increases your risk. By smoking, it does not mean you're going to get cardiovascular disease. It just means you're at a much higher risk of developing cardiovascular disease. So you've got to be careful with what we mean by that word risk. Okay, so now that we've talked a little bit about those two things, obesity and smoking, let's talk about a couple of the ways in which cardiovascular disease can be treated. Before we talk about how we treat cardiovascular disease, let's just summarize the causes. Now, there are a few other causes, but let's talk about the ones that we've talked about. So we've got damage to vessels from chemicals in smoke. We've also got this idea of high blood pressure. And the high blood pressure can come from narrowing vessels. And here we also talked about the fact that these fatty deposits form on this damage. Okay, so actually we also know that having sort of too much fat in your bloodstream is also sort of a potential cause for cardiovascular disease. All these things sort of increase our risk of it happening. So when we're thinking about how we treat it, if you're looking at this as a doctor, we've got some different routes that you can take, okay? So we can look at these different causes. So if we've got a smoker who's at high risk of cardiovascular disease, simply stop smoking. Could be one thing. If we're then thinking about having too much fat and being obese, we've got things like diet that can help. We've also got exercise that can help. Now, these two things here, exercise and diet, need to be controlled, because if somebody is at really high risk of cardiovascular disease, telling them to go run marathons is not the best start, but it could just be actually getting them doing some forms of exercise in a managed manner. Now, there are other treatments as well. If we've got sort of high blood pressure, we can actually use drugs. There are drugs that can treat that high blood pressure. Also, another treatment that we can have is something called a stent. Now, a stent is how a narrowed blood vessel can be treated. So if we have a narrowed blood vessel, we can put this little bit of a metal mesh, okay, or a little tube, into the blood vessel to basically widen it back up. Now, those stents, okay, can be administered in different ways, but one of the ways in which it can be done is through open heart surgery. Now, having open heart surgery is a massive operation, and if you have to have treatment by operation for cardiovascular disease, you will probably have to take some form of drugs for the rest of your life. Okay, so let's sum up what we've talked about in this video. So we've talked about cardiovascular disease as an example of a non-communicable disease. Okay, it is something that is caused primarily by your lifestyle choices. So cardiovascular disease is a disease of the heart. Okay, it's where our blood vessels in the heart, our arteries in the heart have narrowed, and it really increases the risk of things like heart attack and stroke. We talked about two main risk factors that contribute to the risk of cardiovascular disease. We've talked about obesity. We've talked about how being obese sort of increases the amount of fat in your blood. And we've talked about how you can actually calculate using some maths whether somebody could be classed as obese, okay, and that is using the body mass index, which is our mass divided by our height squared. But we've also talked about the hip to waist ratio, which some research has shown to be better and more accurate to predict somebody's risk of cardiovascular disease than BMI. Essentially, the larger that ratio is, the higher the risk. We've also talked about smoking, the fact that smoking contains all sorts of chemicals which are absorbed by the lungs that go into your bloodstream. Those chemicals can then damage the walls of the blood vessels. Once that damage has been created, fat in the blood will then sort of attach to that damage, and it will create a blockage. That blockage can then get so severe that blood flow, it can't flow through anymore, and it starts to form a blood clot. Okay, and that is when the blood stops flowing, and that can cause things like heart attacks and strokes, because the muscle around the area of where that blood is going will not be able to function, or it could just be starving the brain of oxygen itself. We've then talked about the treatments. There are lots of individual treatments for cardiovascular disease because there's lots of different sort of causes and risk factors that could be thought about. So the causes that we've got, we've talked about how we get damaged vessels, we get high blood pressure, we've got those narrowing vessels and sort of having too much fat in the bloodstream. So different treatments that we've got: simply stop smoking, doing more exercise, have a healthier diet. But there are also drugs that can be taken that can sort of help with narrowing vessels and sort of the blood flow. And also there is operations and things called stents, which are little meshes that can be put in to help widen out blood vessels as well. So hopefully in this video you've got an idea of cardiovascular disease, talking about it as an example, and also talking a little bit about risk factors as well. So thank you very much for watching. As always, please like the video, subscribe to the channel if you haven't. It's great to have your support. So thank you very much for watching, and as always, I'll catch you in the next video.